Oh, there's a couple more coming in. Let's wait a second here. All right. And we do have someone watching on Facebook. So actually 3 people. Hooray. All right. Well, thank you everybody for coming to the first of our Ollie Shorts for 2024. I'm so excited. I love the month of February and doing these half-hour little programs. They give us a taste of what's coming up, and I'm just so excited. Today, as you know, we have Mary here who is going to talk to us about telehealth. And I've known Mary for a lot of years and a lot of
many. I would say
yeah.
that's really scary to start putting a number on that.
I know. I wasn't gonna do that. So but a lot.
And I won't either.
Yeah, like we were 12 when we first started being friends.
Pretty close.
But I'm really glad that you're here today and talking to us about telehealth. That's something I'm very curious about. So I'm just gonna hand it over to you, Mary.
Well, wonderful. And I am going to, I put together some slides just to kind of keep me organized. But please feel free, we're a small group, so please feel free to jump in and ask questions as you think of them. So don't wait till the very end, because if you're like me, I forget by the time I get to the end. It's like, I had a question, but I don't remember what it was. So I'm going to just pull this up real quick here. And we're going to just kind of get things rolling here. Did I miss? Yep, there we go. Everybody should be able to see that. So just kind of knowing that this is kind of what we're talking about today, and I'm not going to spend a lot of time on either one of those slides because that's kind of why we're here. But did want to kind of give you a little bit of an overview of where I live professionally. And so I'm with the Great Plains Telehealth Resource and Assistance Center. We shorten that way down to be GP Track because that's just a whole lot easier. And while I live here in just outside of Sioux Falls, I'm lifelong South Dakotan. I professionally, my employer is actually the University of Minnesota. So GP Track, and I'll kind of get back into kind of who we are and what we do, but this is kind of our service area. So we cover, we live in the, like I said, the University of Minnesota, but we cover 6 states. And so just a little bit about what the telehealth resource centers do, and it's kind of like what I'm doing here today. We are basically an information place. There's 14 of us across the country. We cover all 50 states and territories. We are federally funded, so we are a place for people to come for free to learn what they need to know about telehealth. Primarily what we do is help healthcare entities of any shape, size, kind, type, representation do telehealth, whether it be implementing it if they're just new to it, or expanding what they have done, or maybe they started and stopped and now they want to revamp and kind of get going. We are here to kind of provide them with some of the guidance and some of the information that they need to know as they move forward. So while there's 14 of us, 12 of us are the regional centers that you see listed there. And then there are 2 national centers, one that focuses specifically on technology and is a place to go to learn more about the technologies that are available. And one is around policy. So policy and regulations. That's one of the big things that we get asked a lot about, because it can be, healthcare in general can be fairly complicated, and telehealth just adds another layer to some of that complication. So we all try to be very well versed in what's happening in our region, and then we have the National Center to fall back on and to support us in some of those activities. So I'm going to start us out with a pop quiz. Since we're all kind of back in school with this class. When do you think telehealth started to be used to support patients? When, 5 years ago? I mean, you can give me a year, you can give me approximate. What do you think? You can even hold up your hand and tell me. Nobody's going to be brave, huh? Oh, somebody's got to be brave. Oh, somebody put something in chat. Ah, oh, somebody knows. Somebody knows about, yes, you guys know 30 years ago is about right. I was that was when I got involved. So you are absolutely correct. This actually is shows that it's even further back than that. I got involved in the 93s with that, and when you think about that, that's even 30 years since this time frame. So this is a little bit of a timeline that kind of shows. I mean, the what I would identify as kind of being the official start is that 1993, and we'll kind of go into that a little bit. But the kind of the mainstream kind of efforts kind of started in, I want to say mainstream, kind of the next wave of efforts was in 93, and then we'll talk about kind of the mainstream of telehealth here shortly. But as we mentioned, the idea really came much earlier. This is an actual real magazine cover of radio news that shows the use of radio to provide healthcare. And they figured it out. It's like, man, if we can do it with voice, why can't we include pictures? And so it was like, wow, that's 1924 was that idea. And then if we think about, the Jetsons, boy, talk about spot on. This was in 1962, and they nailed it almost exactly. It's I mean, we chuckle. It's like not maybe quite that personal, but darn near. So this is kind of when we talk about the kind of the first start. Believe it or not, it was the University of Nebraska, that medical center that kind of got started. And look at that old piece of technology way up there in the corner that was used. That was basically a satellite connection, closed circuit TV, from one place to another. They basically were just testing to see if it would work, and it was a connection for specifically for behavioral health services or mental health services from Omaha to Norfolk. So it's Nebraska has been doing this for a very long time. They kind of stepped even up into it further in 71, and here we are. Of course, COVID is what really shifted everything. When I talk about the mainstream, this is what created the mainstream, the big news, telehealth. We can do it. It became a requirement during that time frame. It was either figure out how to provide healthcare services through telehealth or close your doors. And that was not an option. So a lot of folks who maybe said, I can't do telehealth. I don't think that's what I should do for patients. All of a sudden went, yeah, I can do telehealth. I think we can make that work. So it was quite a shift. And honestly, not everybody maybe shifted into it smoothly. And we'll kind of talk a little bit about that as well. But really, the pandemic created a situation where telehealth was really no longer this little niche thing that was kind of cool and maybe interesting to do. It really became a requirement and a necessity. It created opportunities for healthcare that really there was no other option. So kind of where does telehealth really fit in now? And I always help people understand or talk about that in this way, that telehealth is a tool in the toolbox. It is not a different kind of care. It is not separate care, or it shouldn't be set up in that way. It really is just another piece of the puzzle, piece of the toolkit in healthcare delivery, that telehealth really will have some role or can have some role in almost every aspect of healthcare delivery and specialty that you can think of. When I did a presentation for some high school kids, I actually created a stump the speaker kind of slide and say, okay, think of a specialty that you think telehealth can't be used in. And they couldn't do it. So we kind of talked through, they were like, well, you know, emergency. It's like, yep, nope, that one's covered. And we talked about that, and we just talked about a number of things. And so even before COVID, these were some of the specialties that utilized telehealth. And I know I don't expect you to read it, but it just is a picture of the broadness of all the types of services that were using telehealth even before the pandemic kicked in. Of course, the pandemic created a real understanding of how we can utilize this technology to support one of the areas that has a lot of need, and that certainly is in the area of behavioral and mental health services. Um, Before the pandemic, we had a lot of providers who were like, I just really need to see them in person. I need to be able to read body language. I need to be able to understand, see their face and understand their expressions, see if they're twiddling their thumbs because they're nervous, that kind of thing. And as a result of the pandemic, they realized that we can do a lot with this, and we can reach people that we couldn't reach by just expecting them all to come in physically. So it's really kind of one of those areas that has seen and continues to see a significant growth. In fact, it has really become more of a standard of the care delivery process now than what it ever was before. So kind of a little bit about what do you need to know about telehealth as a patient, as someone who might actually be a user of this type of technology. And so really understanding that the term telehealth is really an umbrella term. So it means many things to people. So if somebody says, yeah, let's do a telehealth visit, let's make sure that you ask, what do you mean when you say telehealth? So that you all get on the same understanding, because it can be anything from what we're doing today, interactive video visits with your provider, remote monitoring is part of that, phone calls, secure texts, pharmacy care, all of those things can fall under the term telehealth. Sometimes people call it telemedicine. Telemedicine is a little bit more restrictive in the general nomenclature anymore, in that it is hospital-based. At least that's how many people say it. Again, there's another reason for coming to that understanding of what is the definition that you're referencing. So kind of where is telehealth provided and accessed in our region? I think that's, I think people still are like, oh yeah, the telehealth is not really out there. It's not really doing a lot, or there's not really a lot of that in our area. Well, in our area, South Dakota is actually one of the leaders in telehealth. And so it's really important to understand that, yeah, it's happening. And you can and should ask your provider about it. It may not be something that they're comfortable doing, but it might just be that they haven't thought about it to visit with you about. But it happens certainly in the hospitals and the clinics. There's a lot of home opportunities. Certainly when we think about behavioral mental health, that's a perfect experience for many patients. We also are stepping into what's called hospital at home. So when somebody maybe comes into the hospital and are recovering from something, is there an opportunity to be cared for at home, as opposed to having to stay in the hospital for your recovery, where there's a lot of opportunities for infection and kind of collecting other germs while you're there, really not in as comfortable of an environment as it might be. Some homes maybe are not appropriate for it, but there certainly is an opportunity there. Skilled nursing homes and assisted living centers, certainly that's a place where a lot of services are being delivered. School-based, a lot of activity around that. Workplace, are there opportunities, especially when we think about, how challenging it is for people to get away from their desk? away from their job in some situations to go either for their own healthcare or to support their loved one in their healthcare. Is there an opportunity to, have that connection happen from their workplace? And then, believe it or not, there are services being supported through ambulance and law enforcement. Most of these, the law enforcement is around behavioral health, and the ambulance services are really in supporting the patient and the providers in the ambulances as they're transporting. So a lot of things that are kind of going on, and all of these are happening in South Dakota. So it's not something that's happening out there, it's happening here. So as a patient, you kind of have some responsibilities around all of this as well. Really, it's understanding and knowing that your technology will work. Kind of like me in my panic today, I neglected to read all of the information and go, oh, yes, oh, no, here it is. So doing my test call would have been helpful. Had I done that in advance, that would have alleviated my concern. Think about that from a healthcare perspective. If you as a patient, you're nervous about kind of doing this as well. Your provider is kind of on a schedule, as we all know. And so, making sure that your technology work, do a test call, have somebody walk through this with you beforehand. Complete all the necessary paperwork prior to the appointment. Is it something that you have to access through your EMR, through your patient portal? Get all those things done so they're ready and prepared, just like you would in a normal visit. And understand that if you, this one I really want to kind of highlight for folks, because this is an area that I think people don't necessarily think about. There are other telehealth companies out there, companies like the Teledocs, those are probably the name you recognize, or Doctors on Demand, some of those kind of companies. They're good companies, and they address a need. The thing to be aware of is there is maybe not as smooth of a continuity of the information transfer as if you used your own provider. So if you use somebody like that, just know that that information is likely not going to get transferred into your own medical record. And that's something that you will need to take care of and let them know if you choose to. Of course, that's your call. But help them know that this is, I've had this visit, make sure that that they are aware of that, and you can enter that into your EMR through the patient portal often. And then understand what creates a good interaction. And this is, I want to spend just a little bit of time on this. There we go. So, for the first, the obvious thing is you got to be there, so, I mean, and being there basically, be there on the time of your appointment, make sure that your connection can happen, all those kind of things. But I think the other thing too is paying attention to some of the things that we might not think about in having a video, because it's not the same as, we don't have the casualness of, like, when we're talking to our kids or our grandkids or our folks. You can kind of walk around, and if the camera's kind of bouncy, it's not that big a deal, and eventually you get a good connection on a good interaction. With your clinical, you want to make sure that you've got good lighting, that you've got, that you have eliminated the extra noise around you, that your audio is good, that you don't have distractions around you, that you don't have other people kind of bumping into the room. It's like, it's like, I just got to grab something, and or you've got, kids running around, and that you have adequate bandwidth. And that's really something to expect on both sides of the interaction. If your provider isn't doing this too, that's a concern as well. When you think about the lighting, you think about, I'll do this where I'll open the window and I'll have great light in the room. Well, if the light is behind you, all you look like is a big black shadow. So making sure that that light comes at you from the front. I mean, even in that situation where you see me demonstrating that, if I had just turned around, that sunlight would have given me a great you could have seen me very well. Making sure the distractions aren't there. I put the picture here about, with in the car. Sometimes the car becomes the most private place you can be. And so that's not all bad, but certainly don't be driving. We've had some of people like that. It's like, yeah, I'm just driving up to so and so. It's like, yeah, no, not during the consult. You're not. Let's slide over to the side of the road. Let's stop, find a place, and then now let's visit. So, I mean, it's just helping people understand that we need to be safe and we need to do this. This isn't, walking down the sidewalk with your provider and chit-chatting. This is a clinical interaction. So just kind of, how things are moving forward. Healthcare will be hybrid. It will be hybrid with in-person, with virtual, with electronic. The term AI is starting to creep in around healthcare as well. There are pieces and parts that make great sense with AI. There's pieces and parts that are quite concerning. So those things will all get kind of filtered around and figured out as we move forward. But telehealth is healthcare, and I want to kind of leave you with that. It will not eliminate the need for in-person visits, but it will be supportive of those events. It will continue to evolve, and it's not scary. It's okay. It's all good. But it may not be yet comfortable to everybody. And so the more you can get comfortable and the easier, the more you use it, the easier it will become. So just kind of want to leave you with a little bit about where to learn more. And then we can just kind of open it up for questions. You can certainly check us out at gptrack.org. We've got just a bunch of information out there. A lot of it is resources around, like policies and regulatory and summary of what's happening around our states. A lot of it is, we do have some patient specific. If we don't have a lot, but we do have some of that information available here at the telehealthresourcecenters.org. That's kind of, we're the national consortium of resource centers, and we all collaborate. So this is all of us. And so you can get to all of us from here, or you can get to here from all of us. So we cross connect and kind of cross pollinate with others around the country. So this is where I pause and open up for questions.
If you have any questions, feel free to unmute and ask them, or you can put them in the chat. Either way works just fine.
I see Mildred had a question. Are most visits charged? And I'll just jump in. So yes, most visits are charged. You are billed for a telehealth visit, just like you would be billed for a clinical visit. Now, there are some aspects that are maybe not billed as at the same level as an in-person visit. They might be billed at a lesser amount, but providers are spending the time in that visit just like they would through an in-person opportunity. So yes, they are billed.
Mary, how do you interface, or do you interface with Sanford, Navera, and VA, or is it separate?
Sure. So and I'm gonna I'll answer that, but Mildred had a follow-up question and she said, does insurance cover? And usually, yes, insurance covers. There are different, some insurances cover differently, but yes, insurance often, I won't say 100%, but high percentage does cover. So just as a qualification for Yardell, the GP Track is not a provider of services, and we're not a provider of technology. We are a provider of information. So we don't interact with the organizations that you mentioned, other than we keep track, we try to make sure that we're on top of what they are doing. They certainly serve, we've got representatives across our 6 states from many of the health systems across our region on what we call program advisory councils. So they help us to stay informed about what's kind of happening in our area. They certainly represent some of those organizations that you mentioned. We have currently we've got folks from Sanford, from Alina, from Essentia, from Altru, from let's see, where else? Nebraska Medicine, just kind of a variety of organizations across our region. So we are not delivering the care. We are just here to help people do it as best they can, do it in the best way that they can.
Thank you.
Absolutely.
Any other questions? All right, well, we do have 6 people joining us on Facebook as well, so I'm really pleased about that.
Great. Great.
Anything else, anyone?
Yeah, and there's, like I say, there's a number of, of in Sioux Falls, certainly Sanford and Avera and well, Rapid City region in South Dakota, they were really kind of unique in the startup of telehealth in our state. We came together as under a grant that really focused on the opportunity to have non-proprietary connectivity. And so that was really very unique. Even at 1993, that was really unique. And for the most part, that has really structured kind of how telehealth has grown in our area since then. So I think you'll see more of it, and don't be afraid of it. I think it's something that we all will get a lot more comfortable with as we go on.
That's a really cool story, Mary. I love it. I love that we've come this far. Pretty amazing. I
Yeah.
still need a flying car though. We haven't gotten that yet.
I know the Jensens weren't exact on that.
Right, right. So I just want to remind everybody that Ollie Shorts are almost every day of the week in February. Tomorrow we have my friend Sarah from Egypt, who's going to be talking about visiting Alexandria to Luxor. And she lives there and she grew up there, so she'll have good information for us, including safety and travel to Egypt. I did want to tell you that our February 7th Turkish Delights has been postponed, unfortunately, but we'll try to get those people back as well. But we will see you here, same link. You save this link, same time throughout February. If you haven't seen the calendar yet, it's in the back of your new catalogs that you just got in the mail. So thank you, everyone. Mary, it's so good to see you, and thank you so much.
Thank
And
you.
everyone, have a great day. Take care.